following up on one of the best in the business. You and I were talking about how I learned of you and your work through Jesse Chappis, and you were just on his show. And he's just like one of the best in the business at asking great questions. If I can do even a small percentage of a good job that he did, I think we'll have a great conversation today. And some of the things that you were talking about in that interview were absolutely like blowing my mind. I couldn't believe some of the topics that you've gotten into. And we talked about, in the introduction, that you have developed over the course of your career somewhat of a distrust in the medical system. I'm just kind of wondering how that kind of came about for you. You qualified in medicine in 1981, so you've been doing this for a very long time. So I'm just curious how that journey unfolded for you.
The journey that started at my very first surgery as a general practitioner, when I walked into, and my patients started saying to me, why do I have headaches? Why do I have arthritis? Why do I have chronic fatigue syndrome? And I had to admit, I didn't know, because medical education is not an education, it's a brainwashing. And it's worse than that. The educators of doctors and the doctors themselves are bankrolled by Big Pharma. And as soon as Big Pharma gets involved, it's the old story, follow the money. Big Pharma does not want healthy people. Big Pharma wants unhealthy people who need drugs because, again, follow the money. And I realized that was how I had been trained. I had been trained to use drugs to symptom suppress. So yes, short-term gain, but long-term pain. Because if you suppress symptoms, then you hide the underlying pathology, and you actually allow that pathology to accelerate and to progress. So, so from the very first day, I realized that doctors were not addressing root causes of symptoms. And, fast forward to today, I now know that all Western disease is largely preventable through good diet, good micronutrients, reducing toxic stress, and so on and so forth. And so now I practice naturopathic medicine, which is all about asking the question why, and I get great results from my patients. But it's all about teaching people to work things out for themselves. That's why I'm so happy to do shows like this, because if I help one person as a result of talking for an hour, then that makes it all worthwhile.
That's amazing. Wow, good for you. I'm curious what sets you apart from other doctors. Do you think other doctors also grapple with the fact that they are just, slinging drugs? Or do you think it's just something that passes them? Or do you think it's something that they realize and then they realize what a hard and difficult position they're in? What they're doing for business, their livelihood, is not necessarily helping people. Do you think most doctors have to grapple with that at some point, or do you think they just are ignorant to that fact?
Well, that's a very, very good question. But what I can tell you is that my approach to medicine has got me into terrible troubles with the powers that be. Because if I think something is wrong, then I will shout about it and I will tell the whole world about it. But when doctors shout about things that they think are wrong, they get done by the General Medical Council, which is the body in this country that regulates doctors. So we now have many doctors that have been struck off because they have publicly voiced their concerns over the COVID jabs, for example. I have been, for my sins, I'm the most investigated doctor in the history of the General Medical Council because, and the present score is Myhill 39, GMC nil. No patient complaint, nobody harmed. And in fact, one of the funny quotes that came from a Freedom of Information Act search from one of the GMC's legal advisors was, the problem with the Myhill cases is that all the patients are better and none of them will give witness statements. So speaking out against, the things that doctors do is a very dangerous business, because you risk losing your professional reputation. I've been suspended by the General Medical Council for my advocacy of vitamin C and vitamin D. And if I was working within the NHS, I would no longer have a job. And of course, doctors are in this country, the NHS is how 95% of doctors are employed. And they are dependent on a regular salary for their mortgage, for their kids at school. So they are financially incentivized to conform. And if they don't conform to the narrative, which is driven by big government and big pharma, then they get struck off and everything is lost. Now, I don't know if you know Dr. Asim Malhotra, who's currently Bobby Kennedy's right-hand man.
Of
I
course.
remember talking to him, and one of the things he said is, when you know the truth, you must let go of the consequences. Now, He has suffered too. He's been hounded by the General Medical Council, but he's stood up to it, and he's managed to escape to America, and where he can do a proper job over there. But it's difficult being a black sheep. As soon as you step out of line, you get done. And I was very lucky because when the GMC came after me, I had an independent practice. I could make ends meet. I had enough patients who were supportive of me, and my daughters by then had left school and gone to university, so I didn't have any major financial commitments. So I was fortunate in that respect. But I've been fighting the powers that be for the last 25 years.
Wow. It's amazing. So grateful for people like you and Dr. Malhotra that do speak out and are taking on some of that risk. But yeah, I love that saying with Dr. Malhotra of like, once you know the truth, you can't worry about what's going to happen afterwards. And I don't want to miss this. I find this very curious. If I were to ask 100 people on the street if vitamin C was a good thing for them, I think all 100 would say like, yeah, it's probably a good thing. What is it about the two things you mentioned, vitamin C and vitamin D? Those
Yes.
seem like very universally considered safe, effective, promoted. Fruit snacks, for example, at the store will have a little label that says, oh, vitamin C is in here. Or most people know that like vitamin D is a good thing for you, and most people are aware of vitamin D supplementation. What is it about those two things that gets the medical community fired up?
Because they work too well. I mean, I'll just give you an example of something that happened in the 1980s in this country was fund holding. And what that meant is that doctors controlled the money supply, and many of them set up their own pharmacies. And that meant they were financially incentivized to prescribe drugs. And I can remember one GP saying to me, oh, if a child comes in with a runny nose, we make jolly sure they go out with a bottle of paracetamol, with an antibiotic and a cough mixture, because that makes us 10 quid a time.
Wow.
That is wrong. Doctors should not be financially incentivized by the treatments that they offer. And of course, I'm saying we can do this just as well, far more safely, far more efficaciously with vitamin C and vitamin D. They're inexpensive, harmless in the doses that I recommend, and do a great job. But the doctors themselves don't want to hear that, and neither do Big Pharma. And of course, the General Medical Council, the Medicine, Health and Regulatory Authority, which is supposed to regulate drugs in this country, they are bankrolled by Big Pharma. So it's they have the power, and they say these things because they can, and they do, and they have the power to ruin doctors' lives.
Wow. Wow, that's just wild. I was wondering if that was the answer you were going to come up with. So I really appreciate that. Again, in the introduction, we mentioned the diseases of civilization. I think most of our audience will be quite aware of what those things are. Tell us about chronic disease, why it's so rampant, why I see it everywhere around me when I go to the grocery store, the airport. It's almost, I mean, not almost, it's way harder to find like obviously healthy people in the crowd than, the people that aren't healthy. And in your mind, what are the culprits that got us to where we are today?
Okay. Now, there are two mechanisms that drive most pathology, including cancer, heart disease, and dementia. One is all about energy delivery mechanisms, and the other is about inflammation. So I learned much of this through my interest in treating people with chronic fatigue syndrome. And fatigue has almost become the new norm. We are a fatigue society. And so I'm interested in the mechanisms that result in that. And the analogy which I like to use is the car analogy. So if your car to go, you've got to have the right fuel in the tank. That's all about diet and gut function. You've got to have some oxygen there, and that's all about breathing techniques. You've got to have the mitochondrial engine, and that's my special area of interest. That's where I have published 3 papers and written books about, because mitochondria take fuel and oxygen from the bloodstream and convert that into energy. And then we need the thyroid accelerator pedal that controls how fast our mitochondria go, and the adrenal gearbox that allows us to gear up to stress. But the single most important thing is the fuel in the tank. And the problem nowadays is that we are fueling our bodies with sugar, carbohydrates, and highly processed foods. And as they get burnt in mitochondria, they produce a lot of free radicals, and we know how damaging those are. Much cancer, much heart disease, much dementia is driven by free radicals and high blood sugars. So if people listening to this podcast, if they did nothing other than cut out the sugar and the carbohydrates in their diet, they were doing themselves a huge favor. So dementia, for example, is now being described type 3 diabetes. Much of it is sugar damage in the brain. Heart disease is all about sugar damage to arteries. Sugar is sticky stuff. It's sticky in the hand and it's sticky in the bloodstream, and it sticks to the lining of arteries and damages them. And when you're eating sugar all the time, your hormones are spiking. First you spike insulin, then you spike adrenaline, and that drives high blood pressure. So sugar and high blood pressure damage arteries, and yes, that results in heart disease and also vascular dementia. And then we have cancer. What makes cancer cells different from human cells is cancer cells can only run on sugar. That is their fuel. Okay, they can get, in advanced cases, we have to think about glutamine, but for 99% of people, if they did a low sugar, low carbohydrate diet, I could almost guarantee they're not going to get cancer. And that's a very important thing to know, because by the time you've been identified with cancer, by the time you've got a tumour, wherever that may be, breast, lung, gut, whatever, you've literally got billions of cells there. And yes, obviously you have to have the surgery, the radiotherapy, or the chemotherapy, whatever, to reduce that tumour load. But if you then go on to a low carbohydrate, a carnivore diet, a ketogenic diet, a sapiens diet, whatever you want to call it, you can massively protect yourself from secondary deposits. So, the single most important thing is diet. And probably the second most important thing is good sleep and exercise. Yeah, so important. And here's another really important thing about diet, because whenever I have a difficult question, I always go back to the first principles of evolutionary biology. Now, what constrained populations in our evolutionary past is food supply. And so we had to evolve strategies to optimize that. Now, when food was abundant, and guess what? In the autumn, it was abundant. We had a free windfall of fruit from the trees, root vegetables, cereal grains, nuts, seeds. It was abundant. And it switched on the carbohydrate addiction gene. And that meant we just ate and ate and ate. And that is survival value for the winter, because you eat and eat and eat, you get fat. And if you get fat, then obviously that's your food reserve that's going to help carry you through the winter when those foods are scarce. But there's another aspect to this as well, because what nature doesn't want you to do, or evolution doesn't want you to do, is to go and do a load of exercise and burn it off and waste that energy. So eating those foods in abundance makes us fatigued. It's an evolutionary survival principle. So it's very counterintuitive. But when you eat a lot of food, yes, you get fat, but you also feel fatigued. But by contrast, when the food supply is not there, what you need to get food is you need physical energy and you need mental energy. You need to be clever. You need to learn to cooperate, to hunt, to track down, to set traps, to throw sticks and stones and spears in order to, run down your prey. And so when you're fasting, when you are hungry, you actually have better brain power and more physical energy. Now, none of us like fasting because it's not nice feeling hungry. But again, it's an evolutionary tool that we need to survive a famine, because the clever people and the fit and the active people with loads of energy, they will survive. They will make that kill or find that new food source or whatever is necessary in order to survive. So we should live our lives with feasting and fasting. So we shouldn't be eating 3 meals a day. There are times when we feast, when food is abundant, and then there are times when we fast. So the general principle that I suggest to people is, first of all, eat a low carbohydrate diet. We should all be doing that all the time. In fact, I have my personal addiction test for foods. And my addiction test for foods is that, if I have one bit of that food and I can't stop eating it, then I'm addicted. So if you gave me a bar of chocolate with, say, 30% chocolate, if I had one piece of that, the whole bar would disappear. If you gave me a bag of cashew nuts, which we know are high in carbohydrate, if I had one cashew nut, the whole packet would disappear.
Yeah.
So I use that as my test for what foods are safe for me. And we need to be on a non-addictive, low carbohydrate diet, and we need to fuel our body with fat. If you're in any, I recommend what I call a paleo, because it's free from dairy products and grains and yeast, which are not evolutionary correct foods. So paleo, ketogenic, so low carbohydrate diet. But for some people, what suits them best is a carnivore diet, which is also paleo ketogenic. The bottom line is, again, humans evolved as hunters. There's a wonderful book called Why Vegans Have Small Brains.
I interviewed the
And
authors of that book. They're great.
yeah, and they make the point, we didn't evolve to become carnivore, we evolved because we were carnivores. And for my sickest patients, very often the carnivore diet is a fantastic starting point because it's low allergen, it's low carbohydrate, it's got it's meat and fat, it's very easily digested. We have a carnivorous gut, don't we? Our guts are more like a dog's gut or a lion's gut. It's not like a cow or horse's gut. It's designed to deal with meat and fat, and they are the evolutionary correct foods. And for many of my sickest patients, that's a great starting point to get them well. And
Yeah.
and paleo and carnivore is all the talk these days. And people have been brainwashed into thinking, oh, we've got to have our fiber for the microbiome, and we've got to have our vegetables, we've got to have our fruits. It's just not the case. We can function fine eating carnivore. So
Yeah.
so that's often a good starting point.